Hi everyone. Today I'll try to clarify, demystify many things about PCOS. So I think you must have seen a lot of content about this condition PCOS, but you may have a lot of gaps in your knowledge or understanding regarding this condition. So my session today, I'll try to address all these gaps. Number one, what causes PCOS? So we need to understand what is the causative event that causes PCOS. So PCOS is an extremely common condition, we know that. So it affects up to 2 out of 5 women in some areas and at least 1 out of 10 women in almost all areas, irrespective of whether in a foreign country or you're in India or you are in different geographies. The prevalence of PCOS is fairly high. So it is somewhere between 10 and 20% is the prevalence of PCOS. And PCOS is a broad term. It refers to very severe condition in some individuals and very mild conditions in some individuals. The health impact of PCOS can be vastly different between people. So some people with PCOS may have mild disturbance in their menstrual cycles or may have a very mild hair growth, but they may be otherwise alright. But some women, their life is turned upside down due to this disease. So they have a very abnormal hair growth, they have acne, they have irregular cycles and the full works. They also have weight gain. It is very difficult to handle. So all PCOS may not be the same. Just because you have PCOS, you need not worry saying that I have PCOS. So PCOS varies between people. Though PCOS is extremely common, it can be polymorphic. So, and the fundamental question, what causes PCOS? The fundamental cause of PCOS is a collection of abnormal genes that we inherit when we are born. It is a polygenic disease. So this disease is very similar to other diseases of similar origin. All of these are classified as lifestyle diseases. So like diabetes, hypertension, obesity, etc. All these are classified as polygenetic diseases where we inherit multiple small genes when we are born, and these genes find expression when we are exposed to an abnormal environment. So when we talk about abnormal environment, what do we mean? So in the modern day, we are exposed to very less physical activity and we are exposed to excess calorie intake. Both of these go hand in hand actually. So if you are not going to do any work throughout the day and you are sedentary, you tend to eat a little bit more also, and also there is wide availability of calories, etc. So because of all these things, there is a explosion of weight gain or obesity, and the weight gain or obesity kind of accelerates the PCOS. So the genes that are responsible for PCOS, they find their expression fully when there is a weight gain which is abnormal. So if a person corrects the lifestyle by doing diet and exercise, their symptoms of PCOS may improve. For example, it's very common to find the girls with PCOS, when they lose weight, say 5 or 6 kilogram weight by going to the gym, working out, and by having a healthy diet, their cycles start coming regularly, and some of them may even conceive if they are married and they are attempting conception. At the end of the day, the abnormal genes do remain all the time. So when you stop doing the diet and exercise, the symptoms are going to come back. So it may not be possible for you to get rid of PCOS, but it is definitely possible for you to actually improve the symptoms of your PCOS. That is irregular cycles, abnormal hair growth, acne, and inability to conceive. Many of these things can be improved by doing a better diet and exercise. But diet and exercise is not the only option for treating PCOS. So there are several other agents which can help you improve your quality of life. For example, if you have abnormal menstrual bleeding and very frequent bleeding, this can be easily treated by using oral contraceptives, and you should not avoid treatment at all costs. People tend to avoid treatment at all costs, saying that you should not take treatment, we should try to treat everything using only diet and exercise. Sometimes despite weight loss and despite exercise, the symptoms of PCOS do not improve, then we need to step in with some sort of medical therapy. Likewise, abnormal hair growth can be addressed easily, acne can be addressed easily, and they can be addressed by medication in addition to diet and exercise. At Magna, we take the approach of using all modalities to improve your PCOS. So we take a holistic approach. We do not say that all your PCOS is due to your lack of diet or exercise. We understand that it's a polygenetic condition, and we approach it with a very lot of sensitivity, and our therapy team will be helping you in improving your diet and exercise. In addition, we'll be prescribing medication to improve your symptoms of PCOS. Apart from this, PCOS can also be mixed up with various other disorders which are actually not PCOS. For instance, if you have a thyroid dysfunction going on for a long time, say your TSH value is above 10 or 15 for many years, you can have irregular cycles also due to the thyroid issue. So this is called a secondary PCOS. So secondary PCOS, it may not be it may completely improve once you treat the thyroid dysfunction. Likewise, there are several other, this is a very simple example. Likewise, there are several other conditions which can be mistaken for PCOS. So what you may be having may not even be PCOS. Some types of hypothalamic amenorrhea, like losing a lot of weight by doing a lot of exercise and diet, may actually make your cycle skip. So this is called hypothalamic amenorrhea. So a careful history examination, an analysis of your lab work will help us identify disorders which look very much like PCOS, but they are not PCOS. So before you self-diagnose yourself with PCOS by watching stuff on the internet, please do visit your endocrinologist. If you happen to be in Bangalore, you can visit us at Magna at BTM Second Stage, Bangalore. We will be happy to help you with the correct diagnosis of PCOS.